Since I started working for Anglicans for Life 25 years ago, I have been reading articles written by Nancy, and I think probably in all honesty, her articles are what kind of got me hooked on recognizing the need to address end-of-life issues. Her determination to never give up in the face of multiple challenges personally and professionally makes her a champion of life for me. She is the spokesperson for the National Association of Pro-Life Nurses, and her own personal testimony only makes you more aware of her graceful spirit. So Nancy, thank you for being here, and we look forward to your talk and then doing some Q&A with you and Chris.
Oh, I'm so glad to be doing that. And following Chris, I've been writing a lot on brain death, and when I was a brand new nurse in 1969, so it's been over 50 years I've been a nurse, they started doing these harvesting and the brain death stuff. And I was watching and I said, you're doing this apnea test where they take them off a ventilator for 10 minutes to see if they breathe. And I said, doesn't the brain start to deteriorate with no oxygen after 5? And the doctors went, well, greater minds than yours have it figured out, which I later learned meant they didn't know the answer either. So my mother always said I asked too many whys, but that's how I got where I am. And just to add a little bit to this talk on brain death, I've been writing many articles on it, and Jai McMath and Zach and everybody else, but it's getting even worse. One thing they had, I wrote a paper and gave it at Trinity College about non-heart-beating organ donation, where you wait for a while, and if the heart stops, then you go in and take the organs, not involving brain death. The latest thing now is they've come up with a new thing that when they talk about non-heart-beating, they realized that non-heart-beating, if they took the heart out, they could restart it in somebody else. So they changed it to donation after circulatory death. Now they've come up with a new one, which is when a person's heartbeat stops, clamping off the arteries to the brain so they have plenty of time to get the organs, which is why I tell people really think about signing an organ donor card. Now, one thing is I have in my advance directive is that everybody's, when I die, any organs that can be given without, causing death or anything, like corneas and skin and bone and things like that, have at it. You can have all of that stuff. But that's from looking at it for so long and being in these death conferences and listening to what people are saying. What they are doing now, and this almost happened here in Illinois a few years ago, a nurse friend of mine called me from Illinois and she goes, Nancy, they're going to have presumed consent. They're going to pass a law for presumed consent for organ donation. Unless somebody opts out, you have to go through a procedure to opt out. You're going to get it if you don't opt out. This kind of tells you how sleazy this stuff is. And she said, it's going to go through. And I said, I have an idea. And she goes, Nancy, you can't stop it. I said, I have an idea. I called my friends at Not Dead Yet, a very active disability rights organization. They don't particularly care for pro-lifers because we talk about abortion, but they like me because I've had a child with disabilities and have worked for people with disabilities. And I told them what was going on, and they said, oh, no, it won't. And my friend called back later, and she said, what did you do? They stopped. I said, this is, really good. Sometimes you wonder about it. When we have other people coming in, the disability people are great. They don't really want to get involved in abortion too much because it kind of takes away from them and they don't want to get involved in that thing, but they're really good on this. So that's just a little extra. But some of these new things are coming, presumed consent. They have that in Spain and some other countries, where unless you've opted out, you're going to get your organs taken without permission or your family or, anyone saying yes. So it is a really scary thing. I'm all for organ donation. I have a daughter-in-law with 2 kidney transplants. And I had a friend whose kidneys failed, and I offered to give him one of my kidneys because you can live with 1 kidney. Living organ donation works very well. he didn't want to because I had my children and all, so he had another friend do it. Unfortunately, it didn't work, but there are options. You know, when you want to do things for people, it's great. But I remember being on an ethics committee, and they brought up, one doctor came in and said, I just buried 2 good kidneys. I said, what? And actually, I knew this patient who was being taken care of, and it was an elderly woman who was comatose after a severe stroke. And he was saying, we did all the brain death tests, but she flunked 1, so we couldn't do it. So he said, I buried 2 good kidneys. And this young doctor said, well, why don't we check the other hospitals and see what their protocol is? I knew the answer, because every hospital has a different protocol on what constitutes brain death. It's something people don't know. So I let him do it. I could have said it, but it's better coming from him. And he came back, he goes, you won't believe it. Everybody's got a different criteria. But I did find one hospital that doesn't have that one test. And everybody goes, oh, that's cool, so maybe we can do that. I said, listen, I said, people are being asked at the DMV if they want to sign an organ donor card. When this gets out, that there's different criteria and that it changes and there's so much stuff going on, isn't that going to really hurt people's confidence in organ donation? And the head of one unit looked at me and she says, Nancy, there are days I could just kill you. I let that hang in the air. It was important that people heard that. So this kind of goes into what I'm talking about is living well and dying well. I've been a nurse since 1969. I have worked in ICU, dialysis, critical care, burn unit, oncology, pretty much everything, home health and hospice. I'm semi-retired now, although my husband keeps saying, stop saying semi, because you really aren't. But I do volunteer work besides write my blog. I've written for national newspapers. I've written op-eds, one of which on the vegetative state cost me my family. People were mad at me for doing it. They wouldn't talk to me after that. Just very strange things. But sometimes you have to do what you have to do. And but I think death, people are so afraid of it. And they go, oh my gosh, you know, it's something that we all have to do. And I've been there many times. And assisted suicide isn't the way to do it. You know, you can die well. And what I did is I've written many blogs on it. And you can get my blogs at nancyvalko.com. The title of my blog, which I started after writing for the newspapers and for Women for Faith and Family and other religious things. I started the blog, one thing is I got out of doing footnotes. And I could just do lines underneath and then it would take you to the website that would prove it. And when I worked for a national newspaper, they said I was probably the best person ever at sourcing stuff. I looked at both ways. I said, I came up knowing the good journalistic principles. You give both sides. You really do. I hate what the media does now, is kind of push a narrative instead of really being open about it. And that's with abortion, infanticide, and everything else. But I have to tell you, I am not a volunteer in the pro-life movement. I am a draftee. When Roe versus Wade came down, I was working in what is now a level 1 trauma unit. We got the worst cases, accidents at burns, I mean everything. I did everything. And Roe versus Wade came out, and the nurses and doctors were talking about it, and they said, what do you think about Roe versus Wade? You know, and they were all for it. And they said, what about you? And I said, no. And they said, well, what if you got pregnant? I said, I'd have the baby or give the baby over for adoption. And they go, you don't know and you can't say until you've been there. And I was there with my daughter when that happened. I have so much sympathy for women facing this stuff. I've taken care of many women. Besides the right to die stuff, I still do quite a bit in there. But the one thing, the reason I became a draftee into the pro-life movement, though, was one thing the pro-lifers said that I said, that's crazy. They said abortion would lead to infanticide and to euthanasia. And I go, no. I grew up in the era of Marcus Welby and, you know, the highest of all ethics. I mean, we knew ethics. It was great. And nobody would willingly kill a person. You know, this was just outrageous. And so what happened when I was in there, I thought, this is really something. And what happened to me was, I thought it was stupid until I read about Baby Doe, this little boy in 1982 who had Down syndrome and a small hole between his food pipe and his windpipe. Easy to fix. And that was like the cases we were given in nursing school. The course would say, parents, I'm sorry, you can't say no and let the baby die. You've got to operate. Well, Baby Doe came out in 1982, and the parents decided, let him die. No surgery. And the pediatricians were really upset, and they went up to one court after another court after another court, and they all said, no, the parents made a decision. And lawyers were actually going to the Supreme Court to plead his case when the little boy died of starvation and dehydration. And I worked with Dr. Ann Bannon, who founded National Doctors for Life. And she interviewed those doctors, and they were so horrified at what was going on that they went in there to try to put an IV in him just to keep him alive until his case could be heard. But it was too late. He had no veins left. When we read about it, I was horrified by the media. And my husband, who was a doctor, my first husband, he said, let's adopt Baby Doe. Well, I was pregnant with my third child, and I said, well, yeah, if that's what it takes, sure, let's do it. The parents refused all offers of adoption, and the little boy died. And then I went, pro-lifers were right, infanticide, because this little boy had Down syndrome, they were going to do that? Well, 5 months later, I had my third child, Karen, who was born with Down syndrome and a very severe heart defect. So severe that the doctor, as soon as I had the baby, came in and said, take her home, she'll last 2 weeks to a month. There's nothing we can do. And I thought, wait a second. And what I did was, I became a researcher. And I would help my first husband write his research papers and all, and I started looking into it. We didn't have the internet in those days. I had to teach it to myself eventually, because I couldn't afford the course. And I found out there was more hope. So I went to the cardiologist, and he was surprised 3 weeks later, and he goes, boy, she looks pretty good. And I said, well, this is what I found. And he said, yeah, actually, there is an operation that is 90 to 100% effective, but I'll support you either way. I said, excuse me, either way from what? He said, well, if you decide not to do the surgery. I said, I'm sorry, but if you would medically discriminate against a person with disabilities, you can't touch my daughter. And he was shocked. My husband said, you were a little bit loud with him. I said, well, he deserved it. That doctor turned around and became the top guy the Down Syndrome Association referred people to, heart doctor. He totally changed. Sometimes when we confront people, I didn't mean to be quite so loud, but I don't care. But it did turn him around, and he was the one Down syndrome said, oh, get this guy. He's really good. Because there was a lot of bad feeling around that. And even from my in-laws said I tried too hard to save that retarded baby. Well, what can you do? It's cost me quite a few people in my family, some of the stuff that I do, but I still do it anyway because it's the right thing to do, and God's there. And Karen, we worked very hard on her, and she was scheduled for open heart surgery at 6 months, but at 5.5 months, she had a bad flu, got very bad, and had to be put on a ventilator. And it was kind of scary. One of the things that happened too, though, is when she had gotten the pneumonia and got in the hospital, I had been very clear with my pediatrician. Everything is to be done. No DNRs, no do not resuscitates. And then a person at the hospital where I had worked tipped me off. My daughter was made a DNR behind my back and against my express wishes. And I went, excuse me, this is unacceptable. This is not compassionate. This is just pure evil. So I had my daughter switched to another hospital where they did intubate her. They did everything for it. I had, at one point on the intubator, a young doctor came in. He says, why don't we get this over with and just pull it? And I said, you touch anything, and I'll have your ass. I'll have you fired. And I went to the head of cardiology, who I'd gotten to be really good friends with, and told him what happened. He said, I'll fire the little bastard. And I said, Arnie, try to educate him. But if you can't, then fire the little bastard. I hate to use bad language. And unfortunately, at 5.5 months, we lost her. She would have had her surgery at 6 months. But I don't think that was a waste. I was glad for the time I had with her. And that's what so many people who've had kids, and I've worked with a lot of people who've had kids with various disabilities, and that love that happens is just amazing. I don't regret that I had my daughter, but it opened my eyes. This incipient pro-life movement, or as I call respect life, because that's really what it's all about. And so I got very active. I got active in the Down Syndrome Association. I worked on the baby doe rules that President Reagan was coming up with, and did everything I could to try to do this, writing op-eds and things like that. And we had a real problem with the doctors. They did not want the baby doe regs at all. So I said, something's really bad, and this is partly due to abortion. It is just such a big thing, and you think it's just the little babies. It spreads out. Well, when I got my first job, when I was still single, in this ICU, we had many head trauma victims, and we took care of them and all that stuff. And I would talk to a lot of them. And this one man came in, young man, 17 years old, and the neurosurgeon came in, very famous, big guy, great guy, came in and he said, "Oh, ladies, this kid's not gonna make it till morning. And it's good, because if he did, he'd be a vegetable." I went, "Wait, what?" And I had been talking to all of our patients who were presumed unconscious or semi-comatose, and I was teased by the other nurses. They said, "Do you talk to your plants?" I said, "Sometimes," but if hearing is the last thing to go, why not? And they thought I was crazy. But this doctor said it to him, and well, the boy didn't die, and I started working with him. And I later found out that Jane Hoyt, in 1994, I think it was, wrote this pamphlet, A Gentle Approach to Interacting with the Comatose or Semi-Conscious. And it was really good. I realized then that's what I did with this young man. And I kept talking to him, encouraging him to respond. Finally, he moved one finger. I called the neurosurgeon and I said, "You gotta see this." So I said, "Mike, move your finger." And he didn't. He goes, "You're crazy." I said, "He is." Well, finally we got him off the ventilator and I got him to say hi. So I brought the neurosurgeon back in and I said, "Mike, say hi." And Mike went, "Hi." He goes, "Oh my God, it's a miracle." I said, "No, we've been working with him." Mike wound up getting better. He went to a nursing home, which I was a little perturbed about. I'd rather he'd have rehab. And we just never knew what happened to him until about 1.5 years later. This handsome young man walks in our unit. He goes, "Remember me?" We go, "No, I'm Mike." And some people started crying. He said, "I just want to thank you for saving my life." He said, "I'm getting married. I just drove here 60 miles from Illinois." It was amazing. And I said, "Well, Mike, you probably don't remember this, but you wouldn't respond to the neurosurgeon." And he got real serious. He says, "No, I remember. I wouldn't talk to him or move for him because he called me a vegetable." So I've been working a lot with people with brain injuries, and that's another way you can get in trouble in the medical field. But it is important that everybody wants to give up. And I wrote a blog, and my blog's at nancyvalko.com. It's called A Nurse's Perspective on Life, Healthcare, and Ethics. I did that after I started writing for the newspapers and other things. And you can actually see what's there. I have a second one there, the articles I wrote beforehand, for other publications. And I really enjoyed doing this. And it's gotten around, like Georgette, that's how she found out about me. But this is the kind of stuff that we need, and these are true cases. So I've been up against many people who have, one man said, "Nancy, you're wrong on brain death, I'm not talking to you." He's finally come around. Because Zach Dunlap and Jahi McMath and the pregnant women who gestated their babies for months if your brain is dead, you can't do that. You've got hormones, you've got all sorts of stuff. It doesn't make sense. We've got to at least try. And I've seen a lot of deaths too. But the thing is we didn't automatically say this person needs to die. And that's what I heard. By the time I stopped working, I was back in another ICU. I'd hear doctors say, oh, nobody should have to live like that, talking about a patient. And I said, you know what a short step that is from nobody should have to live like that to you shouldn't have to live like that? I said, nobody should live like that. Just because you wouldn't want to live like that doesn't mean nobody should. And that's going to interfere with how you take care of this patient. And some people actually paid attention. And we wound up having more people recover that weren't expected to. So I've written articles about hospice and not just brain death, with all the shenanigans going on there, and the organ donation, which, by the way, I wanted to say, my last blog was Canada and the euthanasia endgame. If many of you may not know, but Canada is now the global leader in euthanasia. And they'll euthanize everybody, tired of life, whatever you want. You know, there's just really nothing that would stop them from doing it. It's actually, you know, it's being pushed, which is wrong. And with these people, it's so easy to say, this is compassionate and this is good for people. You know, they want to die. Well, I've worked with a lot of dying people, a lot of suicidal people, and it's so unusual for me that we think suicide is a tragedy to be prevented, but the right to die is a wonderful thing. Well, it isn't. And I've seen that before. One of the things, and particularly with critical care, and sometimes I'd have people who said, I want to die. I had one woman who wanted to die, and she said, I'm going to get out of here and call Dr. Kevorkian, who was there at the time. And I said, let's talk. And I've talked to these people, and we talked about what this would mean to her family, to herself, what the repercussions could be. And the one thing that really got her was she was so proud of being a good real estate agent. She said, I am the best. And I said, you know, if you do this, they'll probably talk about you as the real estate agent who committed suicide. She goes, wait, what? She says, no, that's not how I want to be remembered. And she wound up choosing life. And she was so happy. You know, she was just like a changed person. And a few days later, some women accosted me in the halls of the unit. They tracked me down, and they said, we are going to have you fired. You talked our friend out of suicide. You have no right. It's her right to die. We are going to get you fired. I said, have at it, ladies. You know, it doesn't matter. But this is what we should be doing, you know, is particularly with people who are elderly. I wrote one blog, and you can get it online. It's called Common Sense at the End of Life, because I've seen too many things. My mother had Alzheimer's and then terminal thyroid cancer and had a trach. And they were treating her, and her thyroid disease was pretty bad. And they brought up a short dose of chemotherapy to my dad, and he goes, well, of course not. And I said, Dad, wait a second. Why do they say that? And so he asked the doctors, and they said, well, it might keep her pain down. You know, it won't cure her or anything, but keep the pain down. And he says, what should I do? And this is where I say the common sense comes in. So many times, things are presented as do or don't do. Sometimes there's a third way. Try it and see if it works. If it doesn't, then you know. And for families, they want to feel like they did the best they could for their families. You know, that they weren't bothering their families. My mother used to always say, I don't want to be a burden on you kids. Don't ever say that. Nobody should ever say that to anybody, because it really is important, you know, how that happens. And people with disabilities, like my daughter, because of her, I started working with kids with different disabilities. And I did babysitting for kids on ventilators. Do you know how hard it is to find someone to babysit somebody on a ventilator? And so we went to the Missouri legislature and said, hey, we need some funding, you know, so people can hire people, you know. we really pushed it a little bit because this kind of stuff is really important. Later on, we had a case, and this is where it got I got in so much trouble, is probably some of you remember Karen Quinlan. She was a girl who went out to a party and became comatose, and the family, was saying, oh, what are we going to do? And the doctors said, let's take her off the ventilator. And so they did. And she kept living. So he said, well, why don't we take out the feeding tube? And they go, no, that's her nourishment. We're not going to do that. Karen lived for 10 more years because of that. That's the other part of the story people don't know. Well, we had a young woman. I knew we'd be a test case because when I was with the Archdiocese of St. Louis, they had come up with a living will. And I go, these things, how they were developed, was not really to be very helpful. And it doesn't really explain things very well to people. Do you want no CPR, no food, no water, people can check off stuff. You don't know until you've been there. And also, how is the person doing? So many times, like a friend of mine, her mom was going downhill and she was elderly and she wouldn't eat. And I said, well, what we could do is try a small feeding tube in her nose and see if it works. If it doesn't, we take it out. And she goes, well, that's just common sense. Well, yeah. And she was back. She got so much better and was like that for a while and then slowly went downhill. And then we fed her whatever she could have, but we kept her comfortable. You don't have to take away stuff to make people comfortable. I've worked with a lot of oncology patients. I haven't had anywhere we couldn't control the pain. But I remember one case, this is kind of what I do. I was asked to admit a patient who had terminal cancer because his pain was out of control. And this was by a very famous oncologist, I highly respected, and said, start him on some morphine as soon as he comes in. I said, okay, let me see. So he came in, the man had no pain. And the wife was there, and I said, can I talk to you a minute? I said, he doesn't seem to have any pain. She said, well, what happened was he's terminally ill, and I found him cleaning his guns. And he looked up at her and said, would you stay in this house if anything happened? And she immediately knew what he meant. He was going to shoot himself. And she panicked and called the doctor and said he's having severe pain. And that's what got him admitted. I said, what do you think? And she said, oh, I want to take care of him. This is my husband. I want to be there for him. I don't want him to do this. I said, you two need to have a very serious conversation. They did. And they walked out a few hours later, hand in hand. And he lived a while longer and died naturally and comfortably. But the doctor was going, what happened? And I said, well, sometimes you have to dig a little bit deeper, when things don't make any sense. But I've seen that. Now, I do have, I really am against suicide, and one of the reasons is I had my oldest daughter, when she was 18, announced that she was pregnant. And she didn't want to marry the boy or whatever. And I said, I'll support any choice you make except abortion. She goes, Mom, I wouldn't choose that. I know too much. I've lived with you. I've seen the prenatal pamphlets. I couldn't do that. So I said, well, if you want to keep the baby or release the baby for adoption. Well, she finally decided to release the baby for adoption to a wonderful pastor, Lutheran pastor, and his wife, and he was blind. And they had another little girl, and they were just wonderful, included us in their lives. We have emails and stuff. And it was so great. But then my daughter got into drugs, and she talked about suicide and got her help, got her drug treatment and everything else. And this was what was so hard, is I saved so many other people from suicide. My own daughter, I could not for lack of trying. And that's sometimes things you have to accept. I'm still glad I had her. She's still a wonderful girl, and I will see her when I see her. But what's interesting with that, a lot of times people want to give up on these people, and they really don't. And she was so good, and we talk about a bunch of things, and she was thinking about suicide and got her some help. And I told her, I said, if you do that, it's going to affect the people around you, and you've got this daughter that you see. What a message is that to give? And she goes, you're right. And she tried again with rehab. And finally I said, well, if you do it, I'm going to give you the biggest Catholic funeral you ever saw. And she goes, Mom, that's dirty pool. And I said, well, it is. And unfortunately, that's what she did when she was 30 years old after a 16-year battle with drugs and alcohol. And it was really hard. But as they always say, suicide is contagious, and people need to know that. After she died, and I told her, I said, this could affect other people, and you've got a daughter. And sure enough, her daughter became suicidal as well as her ex-husband. We were able to save both of them, which was good. But that's how bad suicide is. It's sending a message out to society and to the family, you know. It is one of the most difficult things to lose a child from. It was bad enough with my daughter with Down syndrome, and we had that. So this is the other side of the story. And when they talk about the assisted suicide thing, like I said, Canada's been the biggest ones to do it, and they'll do it for pretty much everything, including tired of life. Thank you. Tired of life, all sorts of things. And with this thing, it's just kind of run rampant. And now they're talking about presumed consent, and also giving euthanasia to people with the sole complaint of mental illness. Now that's on hold. It was supposed to take place this March, but for pretty much any other reason. And one thing that was interesting is people have been upset. Canada's really kind of gone off the rails a little bit. And what they found is that there was an article, and I wrote about it in my blog, talking about some of these people with disabilities or whatever felt pressure to commit suicide. And one gentleman talked about it, and the disability bias is just so bad. And he said that the nurse said, well, maybe you should do that. You know, it's costing $1,800 a day for you to stay in the hospital. And amazingly, one of their physician groups up there who supports assisted dying says that actually it should be brought up to patients they think it would be appropriate to. So they bring it up to the people they feel it's appropriate for. This is how far down the road we've gotten. It's like for any or no reason at all. It's just something you don't do. And people don't realize, and I realize often early with Oregon and the rest of them, these suicide laws start to change. They go, no, there's no slippery slope. Don't look here. That's exactly what happened. It just follows. If you follow the logic, it goes all the way down the logic. And they've lost a lot of people. The suicide rate there has gone way up. But a lot of these disabled people, people without homes and stuff like that, they're being pressured. And this doctors group said it should be brought up. It's a professional obligation to people you think might benefit from it, to bring it up to them. This is really scary. And one of the things I said was so interesting when I wrote about this, Dr. Zeke Emanuel was writing about end-of-life issues. And he was one of the future architects of Obamacare. And one thing he said was, it may come to our collective determination as to whose lives are worth saving. During COVID, there was a lot of talk about rationing care. In the Hurricane Katrina, in one hospital where they were stuck with the water around, several patients were dispatched with large doses of morphine. They were let off by a grand jury. But this is really scary. We have lost the respect for life, not just at the beginning, but particularly at the end. You look at some of these people. But it's so wonderful to see a good death. And I just wanted to, I work with a lot of hospice patients. One was a friend of mine's mother, and she was in her mid-90s. And we helped her, you know, when she go in the hospital, and the doctors go, well, you know, and she said, yeah, I do want that, you know, and she did. And I was there with her. But finally, she was on hospice at home, not uncomfortable. And I'd go over there every week, and we'd pray and laugh and watch episodes of Barney Miller and Bewitched, which she loved. And she looked at me and she said, Nancy, I don't want to live to be 100. And I said, well, Melissa, you can't always get what you want, but if you try sometimes, just might find you get what you need. And she said, that's beautiful. Is it Shakespeare? I said, no, it's my favorite Rolling Stones song. She just thought that was great. She died at 99 years, 9 months, and 5 days, being cared for at home by her family and me. So this is what we're going for, is to have a good death. Not that you don't miss people or whatever. It's that we try, and we don't automatically. Everyone who's a doctor or nurse, I've never met anybody who didn't, has seen an unexpected recovery. They thought somebody wouldn't come back. They thought they were too far gone, and they came back. Giving up too soon is really hard. You know, when I was a nurse and we had all the good ethics and stuff, quality of life was something to improve, not be judged. And we would never deliberately do something that would end somebody's life. And we've gotten away from that. We need to get back on it. And part of the reason is abortion has softened up our country and our people. And it's all about, it's my right to choose. They don't realize it's going towards, we can choose for you. So I'd like for you to think of that. And if you can see my blog, feel free to do it. You run it off or whatever. It's fine, but I once got in trouble with an ethicist. I was doing a debate at St. Louis University Law School. And he would get up and say, I want to counter that. You know, the person I was doing had trouble with it. And finally they said, you have to sit down, you know, it's for the kids. And afterwards, this guy took me aside, and he's a very big ethicist in St. Louis. He's now late, but very big, very well known. He took me aside and he said, don't you ever do that again. I said, what? He said, tell those stories about your daughter and your patients and your mother. He said, that's unfair. And I said, you know what? It just occurred to me, isn't this how Christ taught? In the form of parables. And I said, come to think of it, some of his weren't necessarily true, you know, they were good. I said, but my stories are all true. And he almost had a stroke right there. I said, I don't mean to upset you. I'm not being a smart aleck. But this is really true. And that's one of the reasons I started the blog after all that, because somebody said, you can't die till you tell all your stories. I said, then I'm going to be immortal. And that's not right. But there's so many stories if we look for them, and I feel like I have to from working in all these areas and seeing this stuff and seeing people turn their lives around and become happy. It's absolutely wonderful. So my husband keeps saying, you're not semi-retired, you know, you're not semi. And I go, I'm happy. I'm doing what I think I'm meant to do. So thank you, and please feel free. In my blog, you can ask questions or comments or anything. I'd be happy to talk to you.